When a patient has an eye or a vision issue, they may have to embark on a treatment journey. The high street optometrist is a really important first port of call for the patient because they determine the correct diagnosis, the correct timing for referral, and who to refer to. Those things go a long way towards determining the patient's optimum or final outcome.
I'm Mehul Patel. I'm a franchisee for Boots Opticians. It's very important that primary care, which is us, works with big centres such as OCL. OCL, I believe, is a very, very large organisation now and is actually growing. We can give patients options because these centres have everything going on. All the common diseases can be done under one roof. It makes our life easier. The patient will come in to us and do a full eye test. From that, our optometrists are able to make a clinical diagnosis. Most eye tests will go, we found X, now we're going to refer you. And most optometrists out in the community or society don't know where that patient's going to end up. Just letting a patient go, it's like giving eye drops and saying, well, just go to the pharmacy and pick any eye drop you want. So it's important, based on my reputation, that we don't send them to just a random person. If I can give a name, a location for my patient, I'll follow that journey through.
And it's a continuous partnership, and the patients then go back to them for longer-term management where required.
And then if we find any abnormalities, we can then go back. I think it's important that patients feel confident that there is a link between optometrist practices, because we're the people who they come into first, and then we've got that relationship and trust with the other side, which is the endpoint surgery.
The trust goes both ways through the experience of sharing many patients. So when an optometrist refers to us, when we have a relationship with them, we trust their clinical assessment and the timeliness of their requests.
The relationship is beneficial to the patient because the patient gets seen on time. Routine in NHS world is 6 to 9 months or more.
Doing this at the right time in the optimum time window is really critical.
The longer you leave the problem, the worse it's going to get.
The collaboration between us at OCL Vision and our optometry partners determine the steps that the patient could end up taking on their treatment journey.